Hello and welcome to Pregnancy Info. Today we will discuss that how long should you wait before getting pregnant again. For most women, it is best to wait at least 18 months between giving birth and getting pregnant again. This means your baby will be at least 1.5 years old before you get pregnant with another baby. This much time gives your body time to fully recover from your last pregnancy before it's ready for your next pregnancy. The time between giving birth and getting pregnant again is called birth spacing, pregnancy spacing, and interpregnancy interval. Why is it important to wait 18 months before getting pregnant again? Getting pregnant again before 18 months increases the risk for certain health problems for your baby, including premature birth. This means your baby is born before 37 weeks of pregnancy, which is too soon. Premature babies are more likely to have health problems and have to stay in the hospital longer than babies born on time. The shorter the time between pregnancies, the higher your risk for premature birth. Low birth weight. This is when your baby is born weighing less than 5 pounds and 8 ounces. Being small for gestational age, also called SGA, this means your baby is smaller than normal based on the number of weeks you have been pregnant. Babies born with these health conditions are at high risk of having long-term health problems or even death. What can you do to help you get the right amount of time between pregnancy? Number 1. Wait at least 18 months after having a baby before getting pregnant again. Give your body this time to recover from your last pregnancy before you get pregnant again. Use effective birth control, also called contraception or family planning, until you're ready to get pregnant again. Birth control helps keep you from getting pregnant. Examples of birth control include intrauterine devices, implants, the pills, and condoms. If you are pregnant, talk to your provider before you give birth after getting an IUD or implant right after you have your baby. If you don't get an IUD or implant right after giving birth, talk to your provider about getting one at your postpartum check. If you are older than 35 or have had a miscarriage or stillbirth, talk to your healthcare provider about how long to wait between pregnancies. Experts don't know for sure why getting pregnant again too soon increases your chances of premature birth and other health problems for your baby. It may be because your body needs time to build up its supply of nutrients like folic acid. Nutrients like vitamins and minerals help your body stay strong and healthy. If your body doesn't have enough nutrients and you get pregnant again too soon, it may cause health problems for you or your baby. For example, your pregnancy starts when you are still breastfeeding. Your baby gets nutrients from your body. After having a baby, your body may not have enough for certain nutrients like folic acid. So, as a result, baby can be with low birth weight. Heal from infections and inflammations. Infections during pregnancy can lead to inflammation in parts of the body like the uterus. If you have a condition like endometriosis during pregnancy and get pregnant again before your body has fully healed, you may have the condition again in your next pregnancy. Inflammation may play a role in premature rupture of membranes. Reset the microbiome of the vagina or birth canal. The microbiome is a group of microorganisms. Microorganisms like bacteria are living things that are so small you need a microscope to see them. Some experts think that microbiomes in a woman's vagina, called the vaginal microbiomes, may play a role in premature birth. For example, having an infection called bacterial vaginosis affects the vaginal microbiomes and can increase your chances of having a premature baby. Also, these microbiome of women who have a premature baby may be different than that of women who had a baby after 37 weeks of pregnancy. Getting pregnant after a C-section. It will take longer to recover from a C-section than a vaginal birth. Even if the birth was straightforward, it's important to give your body time to recover before you start trying to get pregnant again. You will need to wait at least 6 months, but your doctor or midwife also advised you to wait for 12 to 18 months. The longer you leave your scar to heal, the stronger it will be. It is particularly important to make sure your scars are completely healed if you want to try for vaginal birth next time. This is because it is possible that the scar may open slightly. This is known as uterine dyshiascence. It may not cause any serious issue, but it may increase the chance of a uterine rupture. Birth option after a C-section. If you have had a C-section before, you can have a vaginal birth after a C-section in VBAC or an elective repeat C-section or ERCS. If you are fit and healthy, both are safe choices with very small risk. You should discuss it with your healthcare provider so he will decide that which way is better for you. He will ask why you had a C-section last time, whether you have had a vaginal birth, any complications during your last C-section or during your recovery, the type of cut that was made in your womb, horizontal or vertical, how you feel about your most recent birth experience, how your current pregnancy is progressing, and if there have been any issue or complications, how many more babies you are hoping to have in the future. The risk will increase with each C-section, so you may want to avoid another C-section if possible. This is all about how to maintain gap or how much gap is necessary for getting pregnant again after your first pregnancy. Share this video with the females who are planning to get pregnant again so they can decide the proper gap between her pregnancies. Till the next video, take care and bye-bye.